Hi, all. Thanks so much for watching Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we welcome two great guests, Dr. Blake Miller, who is the founder of Freedom Functional Medicine, and Kelsie Loy, who is the COO and co-owner of Freedom Functional Medicine. Thank you both for being here.
Thank you.
Thanks for having us.
I'm going to start by, why don't you tell us a little bit about your practice, because it was formed out of the interest of helping patients get the care that they need by addressing root causes. So tell us a little bit about why you decided that you wanted to start this, why it was a need in the community, and then you said there's an interesting story about how you came to the name as well.
I started Freedom Functional Medicine in 2023. I was working as an orthopedic surgeon in the conventional system. I had kind of transitioned from a trauma practice to a more just a regular or just general orthopedic practice. I trained and did trauma for my fellowship. That's what I wanted to do. And then I kind of fell into this general orthopedic role after COVID. I started to see a lot of systemic problems with the system in general. People were not healthy. I couldn't fix them with total joint replacement alone. They had a lot of systemic failure in terms of the physiology. They had a lot of systemic failures. And I didn't have time. I was operating as a technician within the system rather than an actual physician. I didn't have time to help them with the things they needed help with. And it was so fractured and chaotic in the way that they received their care that I felt there was a better way to do it. Serendipitously, I was able to get out of the role that I was doing in general orthopedics and started Freedom Functional Medicine in a more holistic way of treating orthopedic patients, realizing that joint pain was more complex than just what a technician needed to do. And so I got into that and then started Freedom Functional Medicine in 2023, online only. And then we opened up a brick and mortar in 2024 in November at a small location up in Rockford, Michigan. And then we moved down to Grand Rapids at a much busier place, much larger place in December of 2025. So the name of Freedom Functional Medicine came out of the idea of freedom for everyone. After COVID, it was a bit of a draconian approach to healthcare in general. Everyone needed to do this specific thing. And so I realized that freedom from myself, so it was a freedom away from the conventional system. So it was freedom from me, freedom from this pharmacology kind of grip that people have. So everyone gets on a drug and you're on multiple drugs all the time. So we're trying to free them from that, and freedom of away from insurance in general. Like, you can get the care that you need, but it has to be outside of the insurance company. So it's kind of this freedom away from the grip of what society is structured around us, the healthcare that they want us to have based on the insurance company. And we always have to ask permission what we can do with patients, and the insurance company will give us approval or not for that. And that's just not freedom to me. So it was kind of freeing you from the system itself and the treatments that you were allowed to have based on the insurance company, what they would cover.
That's really wonderful to hear that you're grounded in these principles, and I think it makes the mission, more vibrant. I'm sure it's more meaningful for you. It must be so much more meaningful for your staff and for your patients. I'd love to hear then, Kelsie's background and how she joined you. You folks were friends, and then she had a background outside of healthcare, which really has contributed, really nicely to the clinic that you've built. So maybe this could be a good opportunity for Kelsie, for you to jump in with a little bit of how you came into this proposition.
So my background has always been customer service and business management. So I had never worked in the health field before. However, my husband, I was obviously with him before he went to medical school, and then married to a physician kind of gave me a little bit of an insight. So I have a background in luxury sales. I worked at Bloomingdale's for a long time, working with really high-end clients. I own my own business, doing wholesale for boutiques across the country. And that really gave me a unique experience as far as like what true connection looks like with people, and really how to foster those types of relationships. And being married to a physician, obviously, I get to see this inside where he is often expressing a lot of his frustrations with patient care and not being able to take care of his patients the way that he wants to. And then being friends with Dr. Miller, I was kind of there at the beginnings of him going on this journey of leaving the conventional medical field, starting Freedom Functional Medicine. And at the time, I had just started my own business consulting firm, and we had been friends for probably 9 years at that point. And our kids went to the same school. So it was this ongoing like morning meetup where we drop our kids off at school and we'd hang out in the parking lot and just throw ideas around with his business. And he'd ask me questions and advice on, how do we take this to the next level? And how do I get more patients to like buy into this idea that I want to take care of them? And so I would throw around ideas, and it was near the end of 2024 that I think he finally just was like, you know what, no, I really want to make this like, at the time he was virtual and he wanted to open a brick and mortar. And so we had some big brainstorming sessions and just really worked for hours on deciding like what that was going to look like. And so we ultimately decided, you got to open a brick and mortar. You got to have a location. You can't just do this type of care, because the care that he wanted to give was bridging that gap that conventional medicine had and really caring about your patients. And I told him, and in order to do that, you can't do it virtually. You got to do it in person. People really crave that human connection. And because he didn't have a ton of business background, that's kind of where I stepped in, and we kind of formed a team between my husband, myself, him, and his wife. And we joke that it's the dream team. We all have very different backgrounds. He's an orthopedic trauma surgeon. My husband's a child psychiatrist. I'm a business major, and his wife was a buyer. So we have very different backgrounds, but we paired up, and we opened our first location at the end of 2024, kind of cautiously. It was a four-room consultation clinic where we were like, you know what, we don't want to bite off too much. We don't even know if people are going to really see the vision that we have. We don't know how many patients we're going to get. And let's just kind of tread carefully and see if we can make this work. And I think we were all very surprised, but, excited about how quickly we grew. I think very rapidly we took off to the point where 6 months in, started looking for a bigger location. I think we've been very blessed where we haven't really had to do any marketing. Our patients have been our biggest marketers and our biggest like word of mouth. And we just very quickly realized, this was our new passion. Like I had never saw myself working in the medical field. And I think being able to bring my expertise along with their passion, it just really created just a wonderful, wonderful business where I think we really truly feel like we're helping people now.
Part of what you do, or a big part of what you do, is trying to find the root cause and address those things to help people without, sometimes medication, sometimes supplements, but it's a pretty complex process of how you're treating people so that you can actually figure out what's really wrong and then solve that for them. And through that, you've built a lot of really strong relationships. You said really strong loyalty. And it was important from the founding of the practice to make sure that you had loving practices that were sustainable, that everybody really bought into. And so why was that something that you thought about from the beginning?
I mean, I think a big part of it was when we were doing our brainstorming sessions about like what's going to set us apart, because there are other functional medicine practitioners nearby. And, part of my job is doing market analysis and who's your competition and what are they doing right. And we had a lot of brainstorming sessions as far as like, what is our biggest reason that we're doing this? Is it obviously to help patients, but like we wanted to bridge that gap of like where the frustrations were. And so in our brainstorming sessions, we would talk about like, well, what, when we go to the doctor doesn't work? Like if I were to go to my practitioner, what do I feel like they're failing in? And so I think we all kind of brought those experiences into this and made that commitment that we're going to do better. And I think because of my background, I was able to kind of come up with these like systems of like, talking about your health is one of the most intimate things that you can do. And I think that patient care really needs to be a lot more intimate in the sense that you need to feel safe. You need to feel heard. You need to feel cared for from the moment you walk in the door, because that's really where the experience starts. It's not, after you're getting your blood work done and, was it hard to deal with billing? It's really like the moment you walk in the door, how are you feeling to the moment you leave? They really say, the first 100 days of the patient's experience with you is where they're going to make that decision at the end if they're going to stick with you for life or not. And so that's kind of, as I've built operations and we've worked as, the four of us on building these teams, it's like that first 100 days, what does that look like for a patient so that they feel safe enough to talk about their health problems, that they feel safe enough that this is the place they want to stick with.
And I think the context of looking at the human health is different than what the conventional system provides. So my premise is that the conventional world looks at it, your body's making a mistake and you must need this drug or injection or surgery or something to correct that the problem that your body is experiencing. I don't think that is the correct premise. I think when your body is actually designed in a very unique and very complex way, and my view is that your body is actually responding appropriately to an environment of which it does not like, and those things we have to pay attention to. And it's designed to work. It has very complex and redundant systems available that it can function normally if you restore the function or if you give it the resources it needs to function appropriately.
Yeah, it's a great paradigm shift that you're bringing in, which is, I think, the whole paradigm shift of more holistic care, and that's the whole premise of functional medicine. And then underlying all of that, I think what you both are bringing in together, which is what this unique partnership I think brings forward, is the idea of really systematizing the process so that the first 100 days are not left up to happenstance or to a friendly receptionist or to a charismatic, clinician. So I'd love to kind of unpack that a little bit more, because as you both know, we are really big fans of what we call the loving organization, and what we've learned through now our study of 19 plus and growing loving organizations around the country is that what they have all done is take a systems-based approach to becoming more loving. So they're not expecting more out of the individuals, but are creating an overall environment in which people can practice to their greatest extent, which I think both of you are really demonstrating. But if you could unpack that a little bit more as to what some of these practices are from both of your perspectives, that would be great.
So from the operational perspective, I try to make it very easy for my staff so that there is no question on what the expectation is for care. So we have created playbooks or SOPs, standard operational practices for everything. Like from the moment the patient walks in the door, we have an SOP for like what you're saying to that patient, how they're greeted, what drinks you're offering them, what we have a SOP for our diffusers, like what oils you're putting in there, what the clinic smells like, for how we're checking them in, what questions we're asking when we do vitals, how are we checking them out. We're not just pointing to the bathroom, we're walking them home to the bathroom if they have to go. Because I think when you have that expectation and those SOPs, your staff don't have to question like if they're doing it right, if they're not. It's like this is the expectation, and it makes it easier for them to do their job when we have all these like practices in place. And I think it also gives, we really pull our employees into those practices where we ask them all the time, like, where do you see gaps? Where do you see that patients are getting frustrated? Where do you see we could do better? We do weekly and daily huddles where we'll say like, okay, by next Monday, I want everybody to bring 2 ideas that they have on how we can create better playbooks or better, SOPs for our patient care. So we really have created almost like 100-day playbook for new patients. So we have all of these touch points when we have a new patient. And obviously after the 100 days, there's a lot of other touch points, but I think those first 100 days are very critical for establishing the relationship. So when a patient signs on, we have like a 2-week touch point where the staff will reach out and make sure that they have had all their questions answered, that if they got put on supplements, do they have questions about that? Do they have questions about our therapies? Then there's an 8-week touch point where once again, we're the ones reaching out to them and making sure that they have a touch point with the physician already on the schedule. And so all of these, we've created systems, because I think if you don't have systems in place, you leave yourself a lot of room to fail. And so we've kind of taken that approach that, like, even though we're not a franchise, let's pretend we might be a franchise one day. How would we copy and paste what we do here? And I think SOPs are really the foundation of that.
And from a medical perspective, I think the basis of that is education. So I've never been, no one's ever called me short-winded before, but I will often, I love to educate people on specific things. And so actually this goes back to when I was interviewing for medical school, and one of the guys that was interviewing me said, do you know what doctor means? It's a Latin term. I said, I have no idea. He said, it means to teach. And then later I found physician is Greek for natural healer. And so I've always been interested in teaching and explaining things to people, because if they understand something, then you don't You don't have to memorize anything. And I think that people are genuinely interested, and this is not a cryptic thing. A lot of the things that we'll deal with can be treated from a fundamental level, and just going through the physiology and the biochemistry of what we've learned can really transform people's lives in a positive way. But the people that work here, they're always very interested in how we do it and what we do, what we're thinking. And I think finding curious people, that when we interview them, they're curious, they want to learn, they have just this, they have this knowledge of, and they just want to continue to grow. We're always looking for people that just want to continue personal growth and understanding, and that to me requires an education. And we always look for people that are curious and hard workers. That's kind of our goal.
Yeah, and I think another part of that too is like with our team too is just, I think finding a non-conventional medical place to work is hard. And I think that a lot of our employees really love working in an environment where they do feel like they are making a big difference in patients' lives, and that their opinions matter on how the care is given, where in some of their other previous jobs, you know, it's been a lot more number based versus care based. And so we've been very blessed with our employees. And when we hire, we always say, you know, we're going to be like a family. We're going to treat you like a family, because at the end of the day, you're not just a number to us. You are, you know, how do we expect you to give our patients good care if you're not receiving that from us? And so we lead by example. If we take care of them, they'll pour into our business, because at the end of the day, our employees don't owe us anything. This isn't their business. They don't need to pour into it. And if we expect that from them, then we need to be giving them something in exchange beyond a paycheck. It needs to feel like, you know, we know their parents' name, we know their siblings' names, we know what's going on in their lives, we're invested in their personal life, we're very like flexible, because this is a choice that they're making by staying with us. And if we want to do better for our patients, then we need to lead by doing better for our employees first.
Dr. Miller, in the pre-interview, you said that you found that there was no good definition of health. And so when you were building this practice, knowing that you are always thinking of the patients and the employees and the experience of both, what does that health look like, and how do you come to a good definition of health?
That's a great question, and it's individualized. You know, I had somebody that said, I want to live healthy after I retire. Well, that's a great question. I mean, you have 90-year-olds that are running marathons. Is that healthy to you, or is it just you want to be around your kids? There was one analogy I heard that one person wanted to be around his kid at a micro and a macro level, meaning that he wanted, if they lived in a different state, he wanted to be financially able to go see them. And then if they wanted to climb a mountain, he wanted to be with them there too. So that to him was a definition of health. I think it's individual for everyone. And so and just like employees, every single person in the office has a different need in their life. They come from a different background. So you need to nurture those things. And I play around a lot and I have a lot of sarcasm, but it's all in good faith. And I know when to back off, because we have such good relationships with our employees that like today is not the day. And they'll kind of subtly let you know that. And you're just like, okay, this is going to be a regular working day. And then you approach them in a different way and say, is there anything I can do for you today? Like I can see you're struggling. And so those things are individualized, and I think it just takes some level of intuition or being around these people long enough to do that. It's no different than a successful marriage. Like you're not going to have good days all of the time, and having that intuition as to what do these people need at this time is part of that. And so that's kind of my approach to that in a sense of like the climate in the clinic and how we approach that, how I approach it at least.
We have this ongoing joke that all of our staff, they're kind of like mid 20-year-old girls, and they all call him their work dad.
Yeah,
and that's kind of the relationship that they have with him, where they're like, you know, they're obviously very comfortable with him and feel like, you know, yes, he's their boss and he's the physician, and they have that level of respect, but they also feel like he's a safe place. And that's really important for us. And as you mentioned earlier, when we interview people, that's a big part of the questions that we ask. You know, like, what would your needs be as an employee? What does a healthy environment look like to you? And as an employee, like, what is the ideal work life look like for you? Because that's an important question about health. You know, if they're going to be healthy here, a lot of it is mental.
I really appreciated what Stephanie had framed maybe a question ago about how you're taking care of the patients as well as your people. And yeah, and then it struck me that I think what both of you talk about a lot is the broader community that you also take care of. And so I guess that's where I wanted to go with my final question is because we didn't get to cover it much during this interview. I'd love to hear both of your thoughts on why you're investing so much in the community. It's not just business. It's not just trying to make money. It's not just profiteering. It's not just trying to get a referral. At least that's what I've gleaned. But I'd love to hear your thoughts on what does it mean to not think of your fellow business people in the community as competitors and what you're really trying to do to encourage the welfare of the whole community.
For me, a big part of that is this big movement that's happening in health. It takes a village. It's not just us. We have to undo a lot of the learning our patients have done, and I'd rather not waste a lot of our time meeting with them undoing damage. I'd rather them be referred to us from a PCP or another physician having a great experience there, and in conjunction we'll also give them good care. I think it's really important for this big movement to happen, and so we've been really passionate about doing like talks in the community. We had one last night where we invited a bunch of physicians here. We did live demos. We talked about referral systems with, zero conflict on like patient, territory. We just were really trying to build those connections because I really do believe that in order to take care of people, it's going to take a whole movement of physicians to just do better, to learn better, to question insurance companies and to put the power back into the hands of the physician. And we're just one clinic. We can't do it on our own. And I think obviously we live in this community. We want our community to be healthy. My kids go to the schools here. I want the schools to be healthy. My kids will work at other places, all the places that we attend. We have to invest in our community, not just our patients.
Yeah, and from a physician standpoint, what I've seen the biggest problem is that often our egos get in the way. We think we can solve everything. There have been a lot of functional medicine practitioners in the area that I've actually learned a ton from because we have mutual patients, but we've gone back and forth and we've been able to share. There are a lot of things that, you just don't think about. It's a complex web of really complex dynamics of how physiology works and the environment of which people live in. And so we will always rely on the conventional medical system. I think we do amazing. I cannot take away from the benefit they have for if you get in a car accident, we're amazing. Our trauma teams, they work like an orchestra. They keep people alive insanely well. And the technology they have to do that is incredible. I get to do that still 10 days a month. And then heart attacks, we're amazing at those. We save people's lives. We know that, door to cath time is really important, and we do a really good job saving lives there. Strokes, we do amazing. Acute care, we are incredible at. And so that's always an important thing. I think that breaking down the walls of these functional medicine people being fringe needs to occur because we do rely on them. We need them to do stuff, but then they also need to realize that they're not very good at the health aspect, or at least understanding how a lot of environmental and diet and all these other things are important for physiology and how human health works, because there's a very complex dynamic interaction with that. And it's the more I get into it, the more I realize how complex it actually is. And so I think that breaking down those barriers and actually having conversations with these people and realizing that we're not actually fringe, this is the science behind it, and not making just people being on 46 supplements just to have them on supplements is crazy. I think you have to have some evidence behind it. It's like, this is what we're going to approach, and this is why.
And I think just to add one more thing onto that, I think at the end of the day, all of our goals, hopefully in the medical field, are to help our patients. And so it only benefits us from having stronger relationships from other physicians. So, if we have a patient here that we're treating for, hormone issues, but maybe they have to go to PT, it only benefits us to have strong relationships, to send them to a PT and then come back and say, hey, this person you sent me to was amazing. I'm feeling so much better. You're helping with my hormones and they help me with this. Like, how could we not want that? How could we not want these stronger connections for our patients' sake, that there's no animosity in between these physicians of talking bad about each other and questioning their practice? I think it takes all of us to take care of a patient well.
What a remarkable vision. Thank you for sharing that with us, and hopefully we'll have a chance to continue to learn from you.
Yeah.
Thank you.
Thank you so much.
And thank you all for watching. We'll talk to you soon. Bye-bye.